I have a long 32 years of practice, and I have seen medicine graduating from simple medicines in cancer to sophisticated equipment, new drugs, new technologies, new targeted therapies. And we are, from the doctor's perspective, trying to help our cancer patients as much as possible with the best technology available at a very cost effective manner. And our patients are our ultimate aim of living as a profession, and we want every patient of ours to be in excellent health and recover as much as possible. As you know, cancers are curable only if they are detected early, and there are about 9 or 10 cancers which can be totally cured, especially in children. So we are all concentrating at our efforts to diagnose cancer early, to try to treat at the optimum levels, and try to see that everybody gets cured. If not cured, they are relieved of their suffering as much as possible. Today, our curriculum, our medical curriculum, and our teaching and our lifestyle is such that we have become very mechanical, and soft skills which are highly needed, especially in the medical field, are slowly coming down. So our new generation of doctors need to be properly taught on communication skills, on other soft skills like understanding the psychology of the patient, how a patient's body language has to be understood, how to have empathy with the patient and compassion in treatment. Along with whatever we have learnt in our medical college, we have to put in all these things and have a wholesome treatment of a patient. So the patient will get satisfied not just with relief of his disease, but also with the kind hope that the doctor provides along with the medicine, which comes only as a person's special attitude from the doctor's side to the patient. So with this in mind, and also the doctor's own health in mind, I designed, with my help of my family, I designed this workshop, which is a soft skills workshop for young doctors especially, where we teach how to understand the psychology, how to talk and communicate with the patient, how to be a good doctor in general, how to use whatever knowledge you have gained from the medical college and from your practice, how to put it to the patient in your best way, and also at the same time how to improve your own self, like how to have mental relaxation, because all doctors are themselves stressed out, how to relieve your own stress, how to manage your finances, how to maintain your accounts and your books and your tax obligations. All these things are taught in a day-long workshop, which is free of cost to whoever comes forward and wants to learn from the doctor fraternity. My father, Dr. Ram Prasad, who passed away last year, was a famous personality, especially for his communication and diagnostic clinical skills. So he was famous not to ask for too many investigations, and he used to have a very good clinical acumen, a very good way of talking to the patient and relieving their suffering. So to keep that memory alive, in my father's name, I have designed this workshop, which will be a regular affair. Probably once in 6 months we will do, selecting topics of interest for young doctors especially, where all these skills that are generally not taught nowadays in medical colleges will be taught to them, so that they become good doctors. So we are trying to propagate this message through the IMAs, through the societies, through medical colleges, through different private and government hospitals, to attract doctors, to make them understand that there is a need for soft skills to be improved, and that you can always improve on whatever you are, whether you are a senior or a junior. Everybody has a little deficiency in their own attitudes and their own confidence. So to improve that, we need to have somebody talk to them. In this regard, we have selected faculty to teach. Especially like for psychology, we have a professor of psychology coming in and teaching us how to understand a patient's psychology. for example, for improving your own self, and for de-stressing, we have an expert in meditation and in the art of good living, Nitika, to do that. Then we have a financial consultant to talk about how to manage your own finances. We have a chartered accountant to talk about what books are to be maintained from the account side, and what are your tax obligations, which some doctors are not fully aware of and they unnecessarily get into trouble. All these things are being taught by specialists in their own fields, who come and tell us. And then it is, this workshop has a importance that it is always interactive. So there are a lot of question answers which are attended to, and there is a lot of time given for interaction between the faculty and the doctors who are attending it.